Well, welcome to the webinar, everyone. Today we get to talk about heart attacks, or at least maybe we get to talk about heart attacks. There we go. Now it's going. It's an interesting thing because it affects so many people, and it's one of those life-altering events that when it happens to you or somebody that you know or somebody that you care about, it really is that wake-up call of, hey, I really need to do something. Well, what most people don't realize is a large portion of the population got all the warning signs in the world before they actually had the heart attack. They just simply ignored them. So let's kind of jump in and see what we got going on. First and foremost, what do we need to know about heart attacks? There's a lot of things that we need to know, but maybe one of the most important things we need to know is this. Do you know CPR? Do you know that the American Heart Association has new recommendations, and so does the American Medical Association with regard to how to perform CPR? There's something called open hand CPR now, and if you are not CPR certified and you know somebody, care about someone, love someone that may have a heart-related issue, take the time to learn what CPR is, and you very well may be the person that saves their life. Now, here's something you hear all the time. The number one killer in America is heart disease. Well, the reality is it really the number one killer? It's really not. See, the number one killer in this country is what we lovingly refer to as hand-to-mouth disease. Our hand finding our mouth way too often with the wrong thing. That leads to heart disease, diabetes, metabolic syndrome, and all the other wonderful diseases that we have, coupled with sleep deprivation, dehydration, constant inflammation, and a lot of the other issues that we deal with. But most of these things are related to this simple task that we do every single day, which is picking something up with our hand and taking it to our mouth. That is the number one killer in this country. The other biggest contributor to heart disease, as you can see, obesity is a major risk. That's an issue. And in fact, if you want to see the heart attack death rates in the country from 2011 to 2013, we're in the South. We're not doing so well down here. It seems like you need to get over to the Nevada area, maybe even some New Mexico and things of that nature that to start leveling out, or maybe up in the northern part of the United States where everything's still country, where people actually have to move and actually get out and do things. Alaska, you can see big open areas with low, and then you have that super dense thanks to Anchorage, and that's where everyone lives. But the reality is we have a lot of heart attacks, and a lot of that is contributed to weight-related issues. Here's some basic stats that you may need to know. 1 of every 3 deaths in the country is caused by heart disease. Again, hand-to-mouth disease is the major contributor of that heart disease, but 1 in 3. 99% of Americans need to improve their heart health. So if you're listening to this webinar, you are the person we are talking to here. This isn't somebody else's problem. This isn't a loved one problem. This isn't a care for problem. This isn't a someone else problem. This is a you problem. It's a me problem. It's an all of us problem. 99% of Americans, according to the American Heart Association, need to improve their heart health. Each year we have an estimated 785,000 people that will have their first heart attack. So we have a lot of people that are going to have a heart attack this year. And then, of course, every 39 seconds, somebody dies of heart disease or stroke. That's just, the numbers as we're dealing with them today. 27% of people are aware of all the major signs and symptoms of a heart attack. So as we're sitting here talking right now, 1 in 4 of you kind of know the things that I'm talking about, know what to look for. 3 out of 4 of the people on this webinar don't have a clue of what to look for. But you need to understand that heart attack is a plumbing problem. It's an issue with the arteries, veins. It is part of the arterial walls. It is something that we are going to learn today. You are going to see why we call it a plumbing problem. But most importantly, we are going to increase the percentage of people that are aware. At least we're going to increase that percentage for the people that are on this webinar. Here are some of the symptoms. So it's not just grab the right arm issue, and now, of course, that is a heart attack. You can have it localized in the chest, just under the breastbone or in a large area of the mid-chest. It can be combination is kind of a chest and neck. Obviously, the arm is an area. Of course, it's the left arm, not necessarily the right arm. So it can be mid chest and left arm. It can be the upper abdomen. It can be, chest, neck, right arm. It can be neck. It can be, left shoulder, right arm, left arm, or it can just be between the shoulder blades on the back. There's any number of symptoms. These are not things to be ignored. If you feel like something's happening, the best thing you can do is call 911. You would rather be safe than sorry. So if you've been told your whole life, hey, it's not a heart attack unless you, grab your right arm and you have right arm pain, you may be ignoring a warning sign that could prevent a much worse condition. So we've talked about obesity. We talked about, obesity being one of the leading causes of heart disease. And part of that reason is this right here. We have a snacking problem in this country. The average daily intake of Americans is over 2,500 calories now. Men, your average snack is at 586 calories, women 421 calories. Some of the worst snackers in the world are those people that are on a health and wellness journey. They take almonds, they set them on their desk, and they think, hey, almonds are a healthy snack. And by the time they've had 3 handfuls, they've had over 1,000 calories and not realized it. It's just one of those things you have to be conscious if you're going to have snacks, what the effect is on your intake. In fact, it's funny, I was out this weekend with some friends, and they jokingly said, calories on the weekend don't count. I can't tell you how many people are very good during the week, following their program, doing everything right. And then on the weekends, they think, hey, that just allows me to cut loose. And they sabotage their week for the weekend. It's just a constant theme. And, of course, we see it most often when we go on vacation, and it's a week-long weekend. And we come back and we've gained 5, 10, 12, 15 pounds. We have to be more conscious of every day what we're doing to ourselves and what effect it's having on our body. This is another big issue in this country. We have a muscle problem. The average man in this country, it has a 28.1% body fat, average woman 40. You can see the healthy ranges right there. This body fat percentage is putting a lot of visceral fat on our organs, tissues, and most specifically our hearts, leading to the heart attacks, heart disease, strokes, and other issues that we have. And then, of course, the biggest one, 74% of Americans are overweight, and this number is growing. 33% of our kids are overweight, but that number right there, demographically, as we'll see, is skewed by some of the demographics. And if we look at each demographic individually, you'll learn that these numbers are actually worse than they generally appear. So let's go through heart disease by the numbers, because this is something that we need to understand when we're dealing with heart attacks. Because a lot of times people are like, you know what, if I ever have a heart attack, then I'll make a change, or I'll do something about it, or the doctor will be able to fix this, that, or the other, or I'll change my diet if and when something happens. So let's look at what really happens. 30% of people, so if you have 1 out of 10, okay, so 10 people on this webinar right now, or however many there are, 1 in 10 of you, or 3 in 10 of you, will not have a heart-related disease issue in your lifetime. Congratulations, that's 30%. 70% of people will, but 30% will not have a heart-related disease issue in their lifetime. That's great. 30% on this call will have a heart-related disease, but will die from something else. So you may die from cancer, or it may be a car accident, or who knows what it may be. But you'll have heart disease, but something else is actually going to kill you. That applies to 30% of the people on this call. For 30% of people on this call, in addition to that, you will have heart disease, you'll have a heart attack, you'll get a second chance, but guess what? You're not going to pay attention to it, and you're going to die from the heart disease anyway. So that's right. So 3 out of 10 of you will not only have heart disease, you'll actually have a first heart attack, and you will ignore all of those warning signs, and you will be dead. In fact, most women die within 1 year of their first heart attack, most men within 2 years of their first heart attack. So just know the numbers, because so many people just don't make a change. And then, of course, 10%, 1 out of 10. 1 out of 10 of the people on this call right now, or on this webinar, discovered they had a heart disease issue on the day that they died. I want this to set in, because so many people say, I'll wait until, or they react to disease or issues. They ignore the warning signs. 1 out of 10 people on this call right now will die of heart disease never knowing that they had it, because you didn't get the second chance. So if this is the Russian roulette that you're going to play with you and the loved ones that you have and your family, I suggest you invest in some life insurance because you're going to have to take care of them some other way. Because you won't be around to take care of your issue to handle it yourself. So this is the reality. These are the numbers. Pay attention to them. Let's look at some facts and figures because, part of these lunch and learns isn't necessarily to scare you, but to tell you how severe this issue is in this country. And heart attacks aren't no joke, but neither is heart disease. And we have a major issue in this country with regard to heart disease. 1 out of every 3 deaths is related to heart disease. We've seen this. We saw this earlier. So 1 out of 3. 1 out of 3 people on this line right now will die of heart disease. Just the reality of what's going to happen. Every 28 seconds, someone has a heart attack. So why are we talking about heart attacks today? Well, because in the time that we started, roughly about 10 minutes ago, we've had, roughly about 30 heart attacks take place. And, God forbid one of the heart attacks was somebody who was actually watching this webinar, but the statistics show it could be. That's how often it happens, is literally from the time we started talking, we've now had over 33 heart attacks happen in this country. And they're just happening all the time. Every 28 seconds it's occurring. That's over 1 million heart attacks per year. Over 1 million that we're having to deal with. It's crazy that this is happening. So you want to know why I said, are you CPR certified? Well, this is why. You need to get this done. That's over 3,000 per day. That's 40% of those are fatal. So if you think about that, 3,000 heart attacks a day across the country, 40% are fatal. That means 1,200 people a day are dying of a heart attack across this country. 1,200 people a day. Every 33 seconds, someone dies from heart disease. That's over 2,600 people per day. That's over 955,000 heart disease deaths per year. This is just heart disease. This isn't a combination of things. This is just heart disease. And then, of course, the National Institute of Health contributes 500,000 heart disease deaths per year to poor diet. So let's let that set in for a second. Remember how we started this out? We said that heart disease was the #1 killer in this country, or at least that's the claim that you hear all over the radio and TV and the news and everything else. And what we said was, no, that's actually not true. It's actually hand-to-mouth disease that causes the heart disease. And right here you have the National Institute of Health saying, well, 500,000 heart deaths per year are directly related to poor diet. So you tell me, which killed you? Was it the heart disease or was it the diet? I think the National Institute of Health is basically saying exactly what we at ID Life have said from the beginning, which is our diet is what gave us the heart disease that killed us. So pay attention. And currently there's over 27 million cases of obesity-induced heart disease in the United States as we sit here right now. That's almost 10% of the population is dealing with heart disease as a result of obesity-induced related issues. We've eaten ourselves into heart disease. That's just what we've done. That's how bad it is. These are the facts and figures. We can't get away from this. This is an issue. And of course, heart disease is costing the United States economy about $108 billion per year on average. These numbers should shock you. The whole idea behind giving these to you is to show you how bad of a problem it is. Because, this month is Heart Health Month. The American Heart Association does a great job of getting information out about Heart Health Month, and we should really pay attention to these things. But, this month we've talked about high blood pressure, cholesterol. We've talked about, all of the related issues of diabetes and heart disease and the link between them. And now, of course, we're talking about heart attacks and heart disease in general and the effect that it has. But this webinar today is basically to culminate. We've blown through all the warning signs. We've passed the high blood pressure. We've passed the cholesterol. We've passed the pre-diabetes and diabetes phase. Now we're into the heart attacks, hoping we survive. But the reality is most of us will not pay attention, and we're going to eat ourselves to death anyway. So the demographic numbers. I'm going to give you a little warning before we go into this. This is not going to necessarily be fun for a lot of people. Because when you look at the demographic numbers and you break it down, you're going to see how bad it really is. Because so far we've been talking about general demographics, the general numbers as a U.S. population. But now we're going to break it down by ethnicity so that you can really see what is behind all of the numbers. Look at this one right here. So, preventable deaths per 100,000 people. I want people to pay attention to this. These are preventable deaths. And of course, black men are at the highest risk of dying early from heart disease and stroke, hands down. This is why so many doctors for African American men over the age of 50 are prescribing a statin drug just as a general rule of thumb, because it is so off the charts. I mean, right now what you're talking about is per 100,000, you have 143 African American men that are dying from preventable heart disease. American Indian is 90, Caucasian or white 81, Hispanic 63, and Asian 47. I can tell you right now, if it wasn't for the Asian population in the United States, our numbers would be far, far worse, as you'll see here just in a moment. But of course, it's not just the African American men, it's also the African American women. Don't forget, ladies, that not too long ago, for the first time in U.S. history, women are the more obese population over men. First time in history that's happened, but that recently has now occurred. So, let's talk about this, ladies. Let's talk about your numbers. It is by far, heart disease is the number one killer for women. It is just something that is killing more women than cancer, respiratory disease, and Alzheimer's combined. 90% of women on this call or on this webinar right now have at least one risk factor for heart disease. 64% who die from heart disease has no prior symptoms. So remember how I said 1 in 10 of a heart attack die not knowing they had anything? Guess what? Heart attack isn't the only thing that can kill you with heart disease. There's a lot of other things, and 64% of the women are dying from it not knowing they had it, which means they're not treating for it. They're not trying to prevent it. They're keep doing everything they're doing because they're not getting their annual physicals, exams, and taking care of themselves. 1 in 4 die within 1 year of their first heart attack, and a woman dies every minute of heart disease in this country. African Americans, let's look at the numbers. 2 times more likely to die from heart disease than white Americans. 49% of African American women and 44% of men suffer daily with heart disease. That's compared to 32% of white women and 37% of white men. African American women and men suffer the highest prevalence of high blood pressure in the world. This is this is African American women and men. Okay, this is just American. This isn't all over the. I mean, the highest blood pressure in the world. I want that to set in for a second. This is one of the number one warning signs of heart disease. African Americans are 77% more likely to be diagnosed with diabetes than white Americans. Remember, diabetes, 68% of people with diabetes are going to die of heart disease. And then, of course, obesity rates have a lot to do with this. 80% of African American women, 78% of Hispanic American women, and 60% of white American women are overweight. Remember how earlier I said 74% of Americans are overweight? Well, this is where the actual, demographics break down by ethnicity, and you actually see where the real numbers are. Again, like I said, if it wasn't for the Asian Americans, our numbers would be much worse than they really are when you break it down by ethnicity. How about Hispanics? Not much better. 1 in 3 have heart disease. Causes more deaths than all cancers combined. 66% more likely to be diagnosed with diabetes than white Americans. Again, diabetes, one of the leading causes of heart disease. Hispanic Americans are age 20 and older. 75% of men and 78% of women are overweight. Above the national average, as you can see. And then, of course, Hispanic women develop heart disease 10 years earlier than their white counterparts. A lot of that has to do with the ethnic diet. What Hispanic culture dictates with regard to the diet, and that is just a contributing factor. I mean, diet and lack of exercise are just something that we're dealing with, and from an ethnic standpoint, especially from a food ethnicity, the things that we grew up with, the things that our parents passed down and our grandparents passed down, have a lot to do with what we are as adults. Asian Americans. Remember how I said earlier, the numbers are skewed by our Asian Americans in this country. 7% have heart disease. That is not a misnomer. That is not a misquote. 7% Asian Americans have heart disease. Causes more death than all cancer combined, even at only 7%. Only 11% of Asian Americans are overweight or obese. Remember, national average 74%. You want to know why it's so low compared to all of these numbers that are so much higher than 74%? There you have it. Our Asian American population is bringing our average down. They are actually making our numbers look a lot better than they really are. And then, of course, 18% more likely to be diagnosed with diabetes than white Americans. Again, that has a lot to do with the Asian American ethnic diet. Very high carbohydrate intake and things of that nature. So the body's converting a lot of the foods that are part of the ethnic diet to sugar. That is a major contributor to leading to diabetes. But even though they are 18% more likely to be diagnosed with diabetes, their heart disease rates are much, much lower because a lot of it has to do with the fact that they eat a lot more vegetables as part of that ethnic diet that white Americans simply don't eat. How about young athletes? Oh, wow. Now, this is an ethnicity that you didn't expect to see, but it is one that you need to know. Sudden cardiac arrest is the leading cause of death in young athletes. A sudden cardiac death occurs in athletes every 3 days. So if you have a young athlete, realize this is happening every 3 days. You may have only seen a news report every so often, but it's happening all the time. 90% of these athlete deaths are male. That's right. This is affecting our young men of this country. More than 52% of these deaths are African Americans, so more than half. I want people to hear this. More than half, and this is of the young male men athletes in this country. We need to pay attention to this. And of course, the average age when this occurs is 17 and a half. This is sudden cardiac arrest in a 17 and a half year old young man. And over half of the deaths are African American. We need to make sure that our kids are getting their annual physicals. They're getting checked. They're getting checked for heart murmurs and holes in the heart and things of that nature. We need to make sure that we're not waiting until something goes wrong before we get checked out. So, say that we do go to the doctor. Say we do find out we have heart disease. What can we do about it? What do we want to do about it? I mean, we're going to have this discussion with our doctor. What is the typical protocol? Well, here's the typical cardiac management protocol, or what we call option A, which is the medical protocol. That's cardiac rehab, lifestyle change, prescriptions, implanted devices, and then, of course, eventually surgery. This is just putting a Band-Aid on it. This is what we refer to as the pill, potion, lotion surgery component. First, you start out with a pill, then a potion, which is a combination of pills, then a lotion, which is some type of implant, rotor-rooter, or something else, and then, of course, surgery. And once we've biologically changed you, now, of course, we have an issue for the rest of our life, and now it's about sustaining life more than anything else. But this is the model that most people choose. Wait till it breaks and then try to do something with a pharmaceutical or medical science. There is an option B, though, and it is to reintroduce yourself to real food. And as you see on the screen, these are fruits and vegetables. For a lot of us, as we watch this, these are new things. These are not something that we see very often. Yes, we see them in the grocery store. Yes, we see them on newsreels and television and things like that, but they aren't a part of our normal diet. They aren't something that we eat on a regular basis. They aren't something that we attempt to make a part of our daily routine, and a lot of that has to do with just our time issue, because we always say we don't have enough time. The reality is this is option B to handle our heart-related issue, which I'm about to explain. Dr. Dean Ornish has done some studies. If you've never read Dr. Ornish's stuff, you should. He's got some amazing stuff out there, but I want to highlight for you a study that he did. The initial study involved 2 groups of heart disease patients. The first one was his control group. They received the customary standard of care prescribed, a diet centered on lean meat, poultry, and fish, along with various medications and the usual advice not to smoke. This is what we call the standard medical treatment protocol for somebody with heart disease. This is what they said. Then he had another group. That was his test group that prescribed a low-fat vegetarian diet. That's right, vegetarian. Brisk walking for a half hour per day, or an hour 3 times per week, no smoking, and stress management exercises. So what happened? What happened in this study? Well, the study findings, the control group got worse after 1 year. Remember, the control group was the one that had the standard medical protocol, the lean meats, no smoking, and the prescription drugs and other treatment. The test group had a much different outcome. Chest pain disappeared within weeks. Cholesterol levels dropped dramatically. Coronary arteries, which had gradually been closing off, actually started to reopen, and angiograms showed clear evidence of reopening in 80% of patients. That's right. So the vegetarians, or the people that went to plant-based diets, actually saw reversal of their heart disease in Dr. Ornish's study. There was one major reported side effect in the test group. Again, this was the vegetarian diet. The test group, the side effect that was reported, the average patient lost 22 pounds in the first year. Now, if you ever had a question that there was an issue related to heart disease and diet, this should open your eyes, because Dr. Ornish's study, his test group versus his control group, the control group being the standard medical treatment protocol versus his test group, which was, hey, what if we basically just got people to de-stress their bodies and focus on diet and lifestyle change, which is a plant-based diet along with exercise on a regular basis. What could happen? Well, what could happen, according to Dr. Ornish's findings, is reversal of heart disease and weight loss. It's an amazing thing. If that wasn't enough, Dr. Greiger came back not too long after Dr. Ornish and wrote this book, How Not to Die. Over 30,000 independent studies regarding, how to reverse heart disease and or prevent heart disease in the first place. And he basically built upon what Dr. Ornish had done and found, pretty much the same exact thing, which is the only thing scientifically proven to reverse heart disease is, in fact, a plant-based diet. To bolster those claims, they went out and got some statistics, and these statistics are actually from the National Institute of Health. And if you look, the percentage of deaths from heart disease is in red. This is actually heart disease and cancer are in red. Green is the percentage of calories on a daily basis on average that come from plant foods. So Hungary has a 91% death rate from heart disease and cancer, but 10% of their average diet comes from plants. Laos, on the other end of the spectrum, has 92% of their diet coming from plants, but only has a 5% death rate from heart disease and cancer. And of course, you can see the United States in there. We are at 78% die of heart disease and cancer, but only 14% of our diet is coming from plants. So there is a direct correlation, according to these findings, of your consumption of plant-based material and heart disease and cancer death risk. So if you wanted to know if the studies were actually true, this is, coming from somebody who was born on a West Texas farm where there was a lot of cattle and other things. It's hard to say, but science doesn't lie. And in this particular case, it seems to be the direct correlation between your consumptions of fruits and vegetables and your risk for heart disease and cancer. At ID Life, we're all about giving you straight information. Whatever the science says is what we're going to talk about. And one of the things that we are clear about is that diet and lifestyle choices will create your nutritional gap, whatever that is. And we're here to basically identify that nutritional gap for you, help you and support you in those efforts, and provide you the information to make informed choices for yourself, for your loved ones, and for the people that you care about. That's what this is all about.